Aloha. Welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper. Today, I will be demonstrating the self-myofascial release and muscle energy techniques for the upper trap. You are going to need the following tools to perform these techniques. The first is a lacrosse ball or a ball of similar density like a softball or tennis ball. The second thing you're going to need is a door jamb or an exposed 90-degree corner to get your head around as you perform the techniques. The upper trap is a neck and shoulder muscle that attaches at the base of the head or skull and runs inferior or down along a thick fascial structure called the ligamentum nuchae, and then runs laterally out towards the acromion or shoulder. When this muscle is dysfunctional, it causes elevation of the shoulder and painful or restricted rotation and side flexion away from the affected side. When this muscle has myofascial trigger points, it causes a referral pain pattern up the lateral aspect of the neck, up and over the ear into the temple. To achieve the myofascial component of this technique, we are going to apply continuous force into the muscle and the fascia in that area for 1 to 2 minutes. We're going to achieve the ischemic compression component of this technique by locating the most tender points within that muscle and that fascial area. When we find these tender points, we're going to pin them down using the ball for 20 to 30 seconds. Within this time, that pain or discomfort will normally become less intense, and that's kind of what you're looking for. When these areas become less intense, you want to find another area within that same muscle and within the same area that is also tender, and apply force to that area for 20 to 30 seconds. If you do this 3 to 4 times, you'll do it for at least 2 minutes. To begin this technique, what we are going to do is we're going to use the lacrosse ball. We're going to place it at the base of the neck, where the neck and the shoulder meet. We are going to provide force inferior through the ball towards the hip or pelvis. One of the common mistakes when performing this technique is to provide force through the ball medially into the neck. So we're going to place the ball at the base of the head where it meets the shoulder, and we're going to bend at the waist about 90 degrees so that I can bring the ball into contact with the door surface. While performing this technique, it's very important that we allow the arm on the affected side that we're treating to hang freely so as not to activate that muscle. To perform the muscle energy component of this technique, we are going to need to stretch the muscle and then provide an isometric contraction. So to do this, what we are going to do is we're going to secure the wrist on the side that we are treating behind the back with the free hand. We're going to pull down and away so that we can create part of this stretching motion. Then we're going to look down and away to the opposite side to create this stretch. We're going to hold this stretch for 10 to 20 seconds. At the 10 to 20 second mark, we're going to use the free hand as a blocking point so that we can try to return the head to neutral using the upper trap. We're going to hold this isometric contraction for 5 to 10 seconds. We're going to release the contraction, and without pulling on the head or neck with the free hand, we're going to use gravity to look down and away, and we're also going to use reciprocal inhibition by contracting the muscles on the opposite side of the neck. We're going to hold this new stretch position for 10 to 20 seconds, And at the 10 to 20 second mark, we're going to block the head off and allow contraction by trying to return the head back to the neutral point. Release the contraction and the blocking hold. And again, we're going to look down and away and increase the stretch by pulling on the wrist. We're going to perform this sequence 3 to 4 times or until you feel the muscles stop giving you a little bit more of that stretch pattern or the barrier as we're looking down and away. One of the mistakes when performing this technique is to use the free hand to take the head and pull it down and away. When using the free hand, it's just to block off the head as we use the muscle of the upper trap or the force of the upper trap to return the head to neutral. The free hand should just provide a block and not provide a pulling force.